Hi everybody, I'm Ed Baker. Thank you for tuning in. This is the Addiction Recovery Channel, otherwise known as ARC. ARC is a TV station, public TV station, that is dedicated to reducing and eventually contributing to the elimination of stigma. The idea being that the more the public gets accurate, current information regarding this brain disease that we call addiction or substance use disorder, the more likely the response is to be compassion and inclusion, and ultimately saving lives. To that end, today we have Mayor Miro Weinberger. We're honored to have the mayor on our show today. Thank you for being on today.
And I'm very glad to be with you. Thanks for including me, and thanks for doing this show. I think breaking down stigma is a real challenge before us and a very important task. So thank you for being so committed to this.
Thank you. Thank you for your commitment too. The mayor is a native Vermonter, born and raised in Vermont. He holds a double major. He's a graduate of Yale University, also a graduate of the Kennedy School of Government with a double master's degree in public policy and urban planning. The mayor worked for 2 senators in Washington, D.C., returned to Vermont in 2002, co-founded the Heartland Group, which is a firm dedicated to affordable housing. That particular group, the Heartland Group, has received 2 distinguished awards, the Smart Growth and Green Development Award. Mayor Weinberger was first elected mayor of Burlington in 2012. He was again elected in 2015 and is just beginning his 3rd term as mayor of Burlington in 2018. The focus of our show today is your administration's response to the opioid epidemic. We know that in 2014, the then Governor Shumlin declared the opioid crisis the #1 threat to the quality of life in Vermont. My first question really to you, that was during your 2nd year in your first administration, was what was that like for you being a new mayor and being tasked with doing something about an unprecedented public health crisis in your city and your state?
Well, Ed, you know, I think about that speech a lot. I was there in the balcony when Governor Shumlin gave that really remarkable speech. I really think what he did to bring ultimately the nation's attention to the opioid epidemic was a remarkable act of political leadership, really unlike just about anything I've seen. He followed it up with action and personal attention in many areas. I have to say, when I first heard the speech, sitting there, I thought it was a great speech. He certainly got my attention, but somehow, you're right. I was still kind of relatively new. I was, just starting. I guess I hadn't been even in an office 2 years yet when they gave that speech. And between being relatively new, between the fact that the way city and state responsibilities are divided, the city doesn't have a public health function, generally speaking. We don't have social workers, generally speaking, that work for the city. I quite frankly didn't really understand when I first heard that speech that I was sitting in one of the most important seats in the state to muster the proper response to this terrible epidemic. And I regret that. I heard it, I was moved by it, and it took me a good 18 months from that point before I really fully understood that it was absolutely my job, and I had a real opportunity to bring about some positive change on this issue. It was really, I was starting, and part of the reason when I finally kind of did focus in, started to happen. The governor followed up his speech with a lot of work, and he did come to the 8 Vermont mayors in the summer of 2015, and basically grabbed us all by the lapels a little bit, figuratively, and encouraged us to look at what Mayor Loris was doing in Rutland at that point. Mayor Loris was a couple years into what he called they called it Project Vision in Rutland, which was starting to produce some impressive results. And He also stayed in touch, and I had growing awareness because of his leadership, as well as then State's Attorney, now U.S. Attorney T.J. Donovan's advocacy around the fact that the Triton County waiting list to get into medically assisted treatment was still in the hundreds that summer of 2015, even though there had been quite a bit of talk and focus on it. It still was hovering way higher than anyone wanted. So I started to get involved in that issue, and then another thing happened that was really quite significant between bridging from where we were then to where we are now, having this, I think, really quite robust response to the opioid epidemic. I hired a new police chief. We hired Chief Del Pozo, Chief Brandon Del Pozo, and the first assignment I gave him on his first day of work was publicly, I said, Chief, you got to review our responses, city's responses to the opioid epidemic, and come back to me in 60 days, and let's figure out what we're gonna do about it. Well, it's been a couple years now, but he really embraced that charge, and things started to really move after I gave him that direction, and then he took it on.
And I can affirm that from after being at your meetings at ComStat. Chief Del Pozo was on the show last month. I know you hired him in 2015, and what a team you and your administration make in doing something about this crisis.
I appreciate you saying that, Ed. I do think of it as one of the, it's clearly the public safety, public health challenge that the city faces, the state faces. The deaths, accidental overdose deaths, dramatically eclipse the car deaths, homicides. Absolutely. It is where our attention should be in terms of avoiding premature deaths.
Absolutely. And just to refer to ComStat again, I've been to a number of meetings. I've been to meetings with you and the chief and other partners that you have networked with, and it's absolutely clear, there's no doubt about it, that the overriding principle is saving lives. It's clear for every meeting, and the focus is data-driven policy, data-driven programming, and that's what's going to save lives. And I think both you and Brandon Del Pozo, I think you're very forward thinkers and you think out of the box. I think that I'd like to bring up your opioid principles, your 11 opioid principles.
Great.
Specifically along these lines, number 3. Number 3 is what you're talking about now. Number 3 is city government plays a unique and vital role in addressing the opioid challenge. And I know that many of your initiatives have been focused specifically on the opioid challenge. Would you like to talk maybe a little bit about Narcan, your support for naloxone?
Yeah, that was one of the, I didn't list it a moment ago and sort of how we got increasingly involved in this, but I think a little earlier, probably in the spring of 2015, I became aware of, really was then a city council. She's now a state representative, a woman named Selena Colburn. Came to me and really encouraged us to think about deploying naloxone with our police officers. And the firefighters were already carrying naloxone at that point. And she made the proper observation that since then, I think we were on kind of the early edge of this, but since then, many police departments around the country have come around to this, that it's a fairly straightforward thing for officers to carry several doses of naloxone, and they are often the first one responding to an overdose scene. Having them carrying that naloxone can make the difference between life or death. We've had a number of people brought back to life by police officers in the field, and I think Vermont. Vermont was quite an early adopter in general, I think, of the ubiquitous deployment of naloxone. And that's probably why people dispute this a little bit, but it's probably why our overdose deaths per 100,000 people has been lower than many other New England states. That probably is one of the reasons, the fact that we got that out there early.
I would agree with that, judging from the statistics and the doses that are distributed to the general public, besides police and first responders.
Yeah.
The general public has easy access to naloxone, thousands of doses per year.
Right.
So, I mean, it's hard to judge how many lives were saved, but you could say certainly hundreds. And again, that's another example of a data-driven innovation that wasn't an easy sell to the general public either. It's a little bit of an uphill battle with measures such as that. The other thing that you've mentioned is the waiting list. Your work in the states, or Chittenden County's work with the waiting list has been remarkable. I do believe that there is no waiting list at this point. There's access on demand, or maybe a few days. Is that what it is now?
Well, there's some debate about this. Yes, the waiting list has certainly been driven down dramatically. You know, and I am proud to have played something of a role in that. Many people worked very hard to bring that about over a long period of time. But I did feel like those community staff meetings helped accelerate the day that we got there by, you know, for people watching at home that maybe haven't heard about these meetings. In some ways, they're the meeting I most look forward to each month. It's a monthly meeting, the final Thursday of the month. We sit at a big U-shaped table with dozens of people from different organizations. It's really quite a diverse range of organizations. There are a lot of law enforcement individuals there from 5 or 6 of the county's police departments. There are prosecutors there. Yesterday we had, you know, I know you were there yesterday. Attorney. We had the U.S. attorney as well as our state's attorney there. We always have the hospital, which is a huge player in this there. We have the Howard Center represented, of course. Many state agencies are part of the meeting. We had corrections.
Turning Point was there?
That's right. A number of nonprofits. Turning Point, Spectrum was there. We have housing organizations that come, and we try to get the most senior people from each organization we can, people that actually can deploy resources and make decisions. That's one of the kind of where the magic of those meetings can be. Yeah, you know, and there's a kind of mutual accountability that flows from getting people together like that. And I do think the fact that the state had to kind of come back month after month and report on kind of how they were doing with getting this hub in St. Albans open, which was the key to finally making the last step of progress to get our waiting list down to effectively 0. That happened about, you know, almost, you know, it will be a year ago in June. There is still, however, and this is something that I'm excited about this. I'm very hopeful about this. Even though there's effectively no waiting list, there is still a wait between the time when someone, whether it's after an overdose incident or whether it's after they've been arrested or whether they've gone to the emergency room or whatever it's been. If someone says hundreds of people in the community, they come into the needle exchange and they're asked, you want to go into treatment in any one of those settings, and it still takes about an average of 17 days currently from when someone says, yes, I would like to go into treatment, and when they actually start receiving medically assisted treatment. That is a problem. That is, I think this is a problem we're increasingly focused on, and you know, I could go on and on about this, but I think this is the task for 2018 is to, in all those settings I just listed, prisons and the ERs and doctor's offices, when someone wants treatment, we can't say, okay, come back in 17 days, because in those 17 days, they will dose themselves with heroin or Oxycontin or whatever opioid they're using every 6 or 8 hours. So, you know, dozens of times.
And they can die.
They can die. They can lose the clarity and the momentum, the motivation that they had in that moment to want to get into, and they get kind of sucked back into this addiction, which is incredibly powerful. And if we can reduce that time to effectively be immediate, you know, before the person leaves the needle exchange, have them go on to take their first dose of buprenorphine, have them take their first dose of buprenorphine or methadone before they leave the hospital. The data shows that we can dramatically improve the outcomes for those individuals going forward from there. And the data is unbelievable. I mean, we should probably make sure, I mean, this is a revelation to me, at least, and I think many people in the room just in the last few months, that if people are trying to get into long-term recovery through abstinence-based strategies, only about 10% of those people can succeed. It's just an extremely difficult addiction to break.
Especially with opioid use disorder.
Yes.
Those kinds of concerns and those kinds of goals reveal a deeper understanding of what this brain disease of addiction is really all about. That you can't expect people to be on a waiting list for a number of weeks and still have the motivation that they had 2 weeks ago. That window of opportunity opens, and there's no telling when it's going to close. So you're exactly on target with that. And just to reflect a little bit about the ComStat meeting, I was at the one yesterday, and I also look forward to these meetings every month. And for the general public, yesterday there was an expert from Rhode Island, Dr. Rich.
Yep, Dr. Jody Rich, right?
Who came in, who heads up an innovative program in the prison system in Rhode Island. And the entire room full of professionals and lay people, there were a lot of people there. And everybody was glued to the screen, listening to every word he said, because he had something to offer. He had something to teach about saving lives. And I know that you're in support of, is it S166?
That's right.
Medication-assisted treatment in facilities where people are incarcerated.
That's right.
Would you like to speak a little bit about that? Because this is another data-driven innovation that is not an easy road.
Yeah, yeah, no. To finish the point, when someone, because I think a lot of people still don't understand what medically assisted treatment is. Mm-hmm. It's a little bit cryptic.
Go ahead.
And it is, fundamentally what medically assisted treatment is that people are taking medicine for their addiction, and that medicine comes in one of really two forms. It is either methadone or Suboxone.
Absolutely.
Or buprenorphine. It's sort of the same. I believe they're basically synonyms, Suboxone and buprenorphine.
Yes, they are.
They're similar. You can get pretty technical pretty quickly. Most people prefer the Suboxone. People who have not maybe been as addicted as long. Some people, it doesn't agree with them, and methadone works better for them. Mm-hmm. They are opioids or partial opioids, which has made many people uncomfortable. When you talk about breaking down stigmas, I think this is one of the most important stigmas for us to break through. Is we need to start understanding opioid addiction as something akin to diabetes. We would never. We're all quite comfortable, I think, with the idea that insulin is this life-saving medicine that diabetics absolutely need, and that they need to be on, many of them, for their entire lives. We, I think, need to start thinking about Suboxone and methadone similarly with opioid addiction, because the results are stunning. People who are getting the medicine, 60, 70, 80% of them stay on the medicine and go into long-term recovery, essentially, and are able to get back much of the life that had been lost to the addiction.
Yeah. I think that one of Dr. Rich's quotes yesterday, he was saying one of his patients came into him and said, "Doc, I'm having this kind of weird feeling, I'm not craving opioids.
I'm not high.
Feeling good about myself. I feel motivated, to seek employment. I'm getting along with my family. It's like really kind of weird." And the doctor said, "That's normal." The idea with Suboxone or buprenorphine and methadone is for the medical professional to arrive at an accurate dose.
Right.
So the person with opioid use disorder avoids opioid intoxication, so there's none of that opioid intoxication involved, and also avoids withdrawal. So they have a balance with which they can function and live in life. Some people may be on the medication for the duration of their lives. Some people may choose to wean off it or taper off it after a number of months or years. But when that same person is not on this medication, they're spending 24 hours a day, like you said, acquiring drugs, maybe injecting drugs 3 or 4 times a day, trying to acquire the money to obtain illicit opioids. It's a whole different ball game. Right. The medication works. And I know that you and I know that Chief Del Pozo are avid advocates for medication.
Yeah, well, we've been persuaded by the numbers, which are, there's been recent research from local research, a guy named Dr. Rawson at the hospital who has been publishing results like we've just mentioned. It turns out, there are examples before that go back some time. The number of overdose deaths related to heroin in France, the Atlantic just reported this week, dropped 79% in 4 years when they went to a low barrier buprenorphine model. So essentially, back to your important question about one of the S166. S166 would essentially make this medically assisted treatment widely available to people when they're incarcerated. And the incarcerated population has a high percentage of opioid users. One of the manifestations of this disease is people end up in trouble with the law frequently because they are stealing to feed their habit or doing other criminal activity. And that period of incarceration historically has been actually a dangerous period for people, and that they have gone, they've oftentimes become, they go through a terrible withdrawal, and then they lose their resistance, their kind of tolerance for opioids during their prison stay, which the tolerance drops quite quickly, and there's this tragic phenomenon of a high percentage of people who are addicted. When they get out of prison, they overdose and die. And,
exactly. At a very high rate.
Rhode Island in 2016 started this program of inducting people into treatment during incarceration. They really were quite aggressive about it. The governor was very supportive of it, put a couple $1 million into this, and they really got to the people that needed to, and they saw a 60% reduction in opioid overdose deaths in the months after the release of incarceration. 60%. It meant that overall, Rhode Island, perhaps uniquely among American states in 2017, actually saw a 12% reduction in the
overall lethality?
in the overall accidental drug deaths, and that is at a time when many states were continuing to see this terrible epidemic rise. So it's a very promising strategy, one that Vermont has started to adopt it, to the credit of the people in the Department of Corrections. They've been listening to this, and they've been, Vermont prisons have been at the forefront of this in many ways, but they are getting more aggressive about it now as these results come out, and as we have these conversations at Community Stat and elsewhere. S166 would kind of codify in law the practices, more or less, that Rhode Island pioneered last year.
I think that is remarkable, and just another example of data-driven innovation and your hunger and your administration's hunger for data that shows things work, and the nerve to try to put these things into practice. Because sometimes, again, it's not an easy road changing the status quo, but the status quo obviously is not doing so well up against opioids, fentanyl, other illegitimately manufactured, very, very powerful opioids coming into our state and contaminating the heroin available to people. And from a lot of people in recovery. There's a lot of people in the field in recovery.
Yep.
And you know how productive people in recovery from addiction can become. It's really incredible. I don't think the general public really is not aware of that.
I agree, Ed. I think there is great misunderstanding about this disease. I don't think it's. I was with a group of city employees yesterday, and I asked, there are these. I don't think people understand the magnitude of this epidemic, even though it has been so much discussion, in recent years since Governor Shumlin's speech and elsewhere. There's this number that weighs on me. I just find staggering that the New York Times produced graphs of and updates the graphs from time to time. It shows that in 1995, right around 1995, countrywide there were about 8,500 annual accidental overdose deaths. And so picture that, 1995, just 23 years ago, right?
Yeah.
8,500 deaths now in 2016, the last year that we have full information for, that 8,500 has risen all the way to 64,000, more than 64,000 accidental overdose deaths, and was still headed up. 17 almost certainly will be higher than that. People don't. I asked a group of city employees who've heard me droning on. I would think city employees, they might have heard me talk about this at least in recent years, and almost none of them were aware of that story. People don't understand that this epidemic was driven. Well, they don't understand that it's bigger than HIV/AIDS was. It's bigger than the loss of life to car accidents in a peak, bigger than the gun epidemic, gun violence epidemic. People don't, in general, I think, have the story, understand the roots of this crisis, which is that we, as a society, just completely lost our way in the manner in which painkillers were prescribed. We had, back in the 20s and 30s after World War I, a very healthy fear of morphine.
We did.
Because out of the experience of so many soldiers coming back from the war, irrecoverably addicted at the time. At the time, we didn't have medically assisted treatment, and very few of them recovered. But we lost that in the 80s and 90s. We lost that fear. It was the pharmaceutical companies, I think, really were the villains in this. I think they're easily demagogued in some areas, but here, I think they really just they used very little, shreds of evidence to completely change the medical field and the way in which opioids were prescribed. And so many of the people who are suffering from addiction were, very talented, high-functioning, skilled people, competitive athletes in many cases, and they just were following their doctor's orders. And that's how they first experienced these painkillers and got drawn into this. And the way I see it, we failed these people once very badly as a society by kind of losing our way. Let's not fail them again by not doing everything we can with these treatment opportunities and making sure that anyone who wants to get into treatment can.
Absolutely. I'm absolutely with you on that, 100%. And certain pharmaceutical companies and also the wholesale distributors, they will be called to task. Senator Sanders has a bill that he's introducing next Tuesday that is very strong in pursuit of pharmaceutical companies and others in that field.
Oh, good. I hadn't heard about that yet. That's
good. Can be proven to have some responsibility in contributing to the opioid crisis. And he's talking about billions of dollars in fines, freezing executives' compensation packages, and incarceration. He's going after them. And I think T.J. Donovan is part of there's a consortium of state's attorneys also that is going after pharmaceutical companies to get some of these resources to put back into our communities to provide people with treatment, to provide people with medication-assisted treatment, to have free naloxone. Also education and prevention, which doesn't come cheap. It costs a lot of money to educate people and to prevent this disease from spreading.
Well, I totally applaud those efforts. The city has been exploring, our city attorney for months now has been exploring how we can be pursuing legal action as well. Many cities and states around the country are headed in this direction. It is an outrage that the Sackler family is sitting on a $30 billion fortune that was almost entirely built by the sales of OxyContin when state and local governments struggle under this, the strain of this epidemic and struggle to provide the treatment opportunities that we should be. It's a historic injustice that needs to be fixed.
It really is kind of mind-boggling how that could have possibly occurred. I think that we're all kind of back on our heels about that. How could that have occurred to the extent, to the degree that it occurred? In the 1960s, we had a heroin epidemic. China White.
Yeah.
When I was a kid, I had 3 or 4 friends that died of heroin overdose. 1960s. How can the 1990s and the early 2000s the entire medical profession buy this argument that there's somehow a low addiction risk with the prescription of opioid painkillers for chronic pain. It's pretty unbelievable how that happened. And I think it's a testament to the power of corporate marketing, what it can do when it puts its mind to it.
I agree that's part of it. I think another element of it, you know, there's a wonderful book on this. I don't know if you ended up reading it. The Sam Quinones, the Dreamland.
Yeah, book, I was part of your book club.
So I figured you probably were. So anyone who's interested in the story of how it happened, I think it's a very compelling read and really lays out the drama that unfolded that made it possible. One thing that has struck me, and it came, you know, I learned it out of that book, but I've sensed it in my kind of work on this is, and why shows like this and efforts to break down the stigma are so important is this was a disease of silence for a long time. I mean, anecdote in that book, that Ohio town where all these teenagers and young adults are dying and had been dying for, you know, it was a town that had one of these pill mills that was just churning out opioids. There was like a decade of kids dying before anyone spoke about publicly what was going on. People were so embarrassed by the deaths. They just, you know, people were not talking candidly about it. They were trying to cover it up. And I do think we are gonna turn these numbers around. We are getting somewhere when you have, you know, I was in conversations with a woman named Dr. Kim Blake, who came to a community stat, and then I mentioned her and her husband's loss of their son, Sean Blake, about a year ago, South Burlington residents. You know, I contrast that decade of parents being silent about their kids with Kim and her husband bravely coming forward and sharing the story of Sean, even while still kind of raw about what happened. I think this is what's finally going to change people's understanding and awareness of this.
What strikes me about that, and what strikes me about you and your administration and your leadership, is the ability to embrace that depth of pain. Most people shy away from that, and I think that's why it goes untalked about and unnoticed, or has gone. In order to do something about this, we first have to face it squarely and kind of embrace the depth of that pain that you're talking about. And once we do that, we can stand up and see it for what it really is and do something about it. So when you talk about droning on with your staff about the numbers, it takes courage and leadership to sustain that kind of focus, to break through to the general consciousness and have them really understand the gravity of what's going on. And that's what I see happening. I'm a witness to it, and I see it happening. I see it at the ComStat meetings, which we've mentioned. I see it in the community recovery centers, wherever I go, because these are the people that I hang around with. I see it. There's a momentum and attraction that is unprecedented, and I think it comes from all levels and all directions. And it's unfortunate that it took this kind of tragedy to make it happen, but we're lucky that we have the kind of leadership that you provide to keep our focus and really motivate resources to focus on this.
Well, thank you, Ed. I appreciate you saying that. I do have this sensation. I mean, like you said, there's so many people I've met in the last few years while working on this that, that are just clearly great members of this community, contributing a great deal, have come through. You know, we almost lost them. They've now put their lives back together. It's another woman, Alicia Herman, who a year ago in the State of the City, I mentioned her story. The only reason she thinks she's alive is that she got a terrible infection related to her, injections, and was stuck in a hospital for 90 days.
Yeah.
And her head kind of started to clear at the end of that, and she then finally had a kind of will to get into treatment, and did. And now, just a few years later, she has really put her life back together. She got married in the last year. She is working.
I know her.
She has a professional job. She was working in one of the testing laboratories, and I think just recently got a job with one of the institutions on the Hill. And I just think how many there are thousands of people in our community that are suffering from this addiction who we have not saved yet. And so it is, I do feel great urgency in the work, and there isn't a lot in local government that feels like matters of life and death the way this does. So it's been a privilege to get to work on this, and I hope it is. It's encouraging to hear you say you feel a sense of progress outside of the room as well.
I do. Jalinda LeClaire, her efforts, the governor's efforts. I was at a meeting with Jalinda recently, and she said, no one is saying no. Everyone is saying yes. When you ask someone for something to pitch in, everybody's saying yes. Everybody, and this is the raising of consciousness. Vermonters are wonderful people. Yeah. And if we can raise consciousness and educate them and give them the right information about what's going on, the response is compassion. No Vermonter wants to leave another Vermonter behind. The response is compassion. It just is that way. It's just clear as day. And just for a number, there are approximately 23 million people in recovery from addiction today. That's recovery from all drugs.
Wow. I hadn't heard that number exactly.
So it's a magic army.
In America, 23 million.
Yeah, magic army of people out there. Wow. And these are people that are anonymous. AA, NA, Cocaine Anonymous. You see people out there 24/7, 365 days a year, there for each other. In the recovery centers, you see a lot of this. People in recovery volunteering their time, going to Peter Espenshade's recovery coach training, becoming recovery coach, peer recovery coaching. There's so much going on so many levels, and being a leader is a very important and a special place. But for all these other people, it's just as special and just as important to them.
Oh, absolutely.
We're part of that same movement. We're almost out of time. I just wanted to end with, I know that you're happily married and have a lovely wife and 2 young children. And I'm a father also. And when Chief Del Pozo was on, we spoke a little bit about fatherhood and what it's like in an era of threat like we have today. And I'd like to give you the opportunity first to speak to parents in closing, and then I'll give you one other opportunity. But what would you like to say to parents out there, Mayor, who have children who are growing up in this environment? What would you have to say to them? What kind of advice or encouragement?
Yeah. I do think this is it's certainly one of my greatest fears as a parent is knowing how many, just knowing how terrible this addiction is, and the thought that our daughters could fall victim to this in the future definitely weighs on me, and it's definitely one of the things that has attracted me to this work. And and again, like I don't think. I mean, one thing I would say is I think there are problems in America that that sometimes people hear about and maybe accurately at some level say to themselves, that's something I don't have to worry too much about. That's not going to happen to my kid. I don't think anyone should feel that kind of comfort with the opioid epidemic. From everything I can see, this is a disease that has impacted the entire community of all socioeconomic levels. In some ironic case, it's actually probably hit the white population more than it's hit minority populations, in part because this was something that started in doctors' offices and maybe come from our own, from some biases. White patients received more opioid painkillers than people of color. So one thing I think parents should understand is they should absolutely be concerned this is something that could happen to their child. What do you do about that? I think, speaking frankly, getting educated, understanding what the disease is, what the sources of it are, taking responsibility. I'm convinced there are still way too many of these opioid painkillers circulating out there in the community, even though at Community Stat we see the trends are finally headed in the right direction in terms of doctors cutting back quite dramatically in what they're prescribing. We know there are medicine cabinets around the state, around the country that continue to have hundreds of these pills sitting in there. If that's in your medicine cabinet, get it out of there. Throw it out. Take it back to the police station or your pharmacy before your child stumbles on it. Before a contractor in your house steals it. We know that kind of diversion of legally prescribed painkillers was a major driver in this epidemic. I think speaking candidly with children, I'm just this week, my daughter and I, she was she's in 6th grade now. But she was asking about it, and I think candid conversations about these risks and how this really isn't something you can experiment with is important. I am not an expert in what to say to your kids. There are other resources out there that Parent Up, I think, is something
I was about to mention that. Is it Parent Up Vermont?
Yeah.
Parent Up VT.
So, I think there's some resources and some help there, but
Absolutely. And to stay close.
Right.
Keep those avenues of communication open and educate yourself, like you're saying. Go to Parent Up Vermont.
Right.
Read a book. Talk to somebody. Find out how to talk to your children and keep that window open where you're communicating back and forth. And not just opioids, too, right? Cigarettes.
Absolutely.
Alcohol, marijuana, which is becoming more and more popular. There are a lot of drugs out there that children really should not be involving themselves with any of them, basically.
Right. It is quite compelling that if you can push back that beginning of experimentation into, the earlier it happened that the teens start experimenting, the more likely they are to have a serious problem. Whereas if people can make it into their 20s or 25 when the brain is sort of fully formed, they're much more likely to be able to control their use of some of these substances.
Right, to make mature decisions and maybe to decide not to get involved, maybe to have a bad experience and stop.
Right.
Kids sometimes want to be cool, so they'll keep doing things. There's all kinds of different variables. Now, in closing,
yes,
I'd like to give you another opportunity.
Okay.
Really, to talk to people out there. There are people out there who certainly have loved ones with opioid use disorder.
Yes.
And there may be people out there watching, and I'm hopeful that there are there, that may actually have opioid use disorder themselves. So what is your message to that particular population?
To someone who's using and has not, my message to someone who's using and watching is there are many resources in the community now to help you. Come to Safe Recovery and talk to Grace, and she can help you get you into treatment. Call up the Howard Center, get into the hub. We can, that is a route in. I think, if there is someone who is watching, who is taking heroin today and wants to get off it, there is help in the form of buprenorphine or methadone that can make, even if you've tried to get off in the past, this can make the difference. And there are people here to help now, and we hope you will take advantage of it. That includes our firefighters, it includes our police department, it includes the emergency room workers. I think increasingly there are an increasing number of places to go. Certainly here in Burlington, we have a woman named Jackie Corbally who works out of the police department. She's a social worker who works there. She will go to the ends of the earth to get someone the help they need if you walk into the police station and ask for help. So it's there are a lot of people here who want to help and help you get to a new place.
Well said. Well said, and thank you so much for being on the show today.
Ed, thank you.
All right.
Thank you. It's really been a pleasure. Thank you for doing this work. It's really important.